Good evening and welcome back to KTN Prime. So our coverage of the doctors, or rather health workers strike, as nurses are also involved, has entered day 2. The talks continue today, not bearing much fruit. With me in studio is a medical doctor. She's also former CEO of the Kenya Medical Association. Her name is Elizabeth Wala. Thank you so much for being with us. As this strike continues, there are those who are looking at it from a moral point of view and ethical, in as far as how do doctors and nurses reconcile with themselves? Lives are being lost, people are dying. On your side, you're seeking a better pay, a better package in as far as what you take home.
Yeah, so thank you very much. I think it's a very valid point that can be seen as almost unethical. But if you look at the other side of the healthcare workers, the conditions in which they operate in, the remuneration that they get, and then the discussions that have been going on ever since 2013, so to speak, at least for the doctors. It's been a long time coming, and I think they have pursued all avenues possible and reached this end where they have had to go the industrial way.
Yeah. Is it not possible to have a middle ground where perhaps emergencies can still be taken care of and you still have a way in which to ventilate and, have your issues, whatever they are, aired out, and perhaps even still go on strike, but not get everybody to suffer, especially emergency cases?
From my understanding, there are counties that already have that in place. Some counties have worked out with private hospitals where emergency care is still being offered. So the critical care patients are being taken care of for the most part.
Yeah. And yet on the other hand, there are doctors that are intimidating those who are choosing to work. So you see on one side there are those that are working, but there are those who do not want to see any of the doctors work, even taking care of the emergencies.
I think that will happen in any large group. For the most part, I think we'd say that over 90% of the doctors are on the strike, and for those of us who are also out of civil service, we do support the strike because it is high time that these issues are addressed once and for all.
Yeah. So how then do you reconcile this? You said this is an issue that pretty much has to then be, because on one hand you're seeking what you deserve, which has been delayed according to what you're saying, but on the other hand there's a mother, a sister, a brother watching and saying, how do you seek more pay and my loved one is suffering?
What I'd like the public to know is that doctors are also human beings. They're also people subjected to the bills that we have to pay. They're subjected to, training needs and all that. So even I, as a doctor, I do have a family. I am paying rent, I'm paying school fees. And when these needs are also not being met, it will be very hard for me to also offer the topmost quality of care that I can when I know my children are not going to school, that I don't have food on the plate, or I cannot meet this and that bill. So it's striking a balance between the expectations of the public and also the needs of the healthcare workers at this point here.
And yet we've been seeing so many strikes, not only now this national one, in the counties, so many of those going on. What do you think will bring that to a stop? And do you also think that devolving healthcare was a mistake?
I wouldn't say devolution was a mistake. What I'd say is that the manner in which it was done was in a hurry, especially the human resource bit. And for us, we are pushing for a central body that's going to manage human resource issues in the health sector. If you look at the health sector strikes, all of them center around human resources. So whether it's about promotions, it's about pay, it's about people going back for training. So all these are on human resource. And there are very many lovely documents that have been prepared that are lying, at the Ministry of Health, at the county government levels, at the Salary Review Commission level, at the Public Service Commission level. It's all about having that goodwill to implement the things that have been agreed upon.
Yeah. Is it correct that the lowest medical officer gets 150,000 in as far as the private sector is concerned, and public 100,000?
For the medical officer intern, because we finish our 6 years of training and then you go for 1 year mandatory internship, the basic salary right now is 38,000 shillings. And then you add allowances, and allowances vary with counties. Like house allowance would vary. In one county they pay 20,000, in another one they'll pay less. So you can imagine that you're starting off on that kind of salary. It is in 2016, it's almost impossible to
Yeah.
make a living out of it, yes.
Because there are those who argue the discrepancy is minimal between the two from public and private sector, and to look that there's also training opportunities for those in public healthcare. Then we're also seeing more and more doctors starting their own private practices as much as they're still in public because there is extra time. What do you say to those who are saying the system itself is broken, so the demands are unwarranted?
I wouldn't say that doctors have extra time. I would say that with the current circumstances in the public health sector where you're barely making out a living, then you'd find that people during their off times, in fact, during their off times, then they'll find extra income doing public service, which is allowed under the law. Private service, so to speak. But then we have also seen, at least from the Medical Association, that our doctors are burning out. They're burning out simply because they're not resting.
Okay.
So today, 8 to 5, they're in this government hospital. At night, they're eking out, a locum at a private hospital. The next day, they're back. So even the quality of care that they're giving is very limited. But if I were a public service, or rather a doctor practicing in the public service, and I was remunerated well enough, I'd have time to be settled and offer the kind of care that I do need to care. And then during my free time, I'm at home with my kids or I'm doing my other hobbies. So I don't need to, constantly, if you look at the traffic jams caused in Nairobi, I wouldn't be surprised that most of them are being caused by doctors running from one facility to another because they're trying to make ends meet.
Yeah. As we bring this to a close, many watching tonight, especially those who will be taking their loved ones to public hospitals, there are those who are there unattended, perhaps watching this and thinking to themselves, what will be the resolution at the end of this? What do you think will be that thing that will make the doctors be able to go back to work, or at least the government as well to be able to budge to your needs?
I think it is for the government to honor the CBA, the collective bargaining agreement that was signed in 2013, that needs to be backdated all the way because it is a legal document. And I think we've been taken around in circles by the ministries, various ministries, and everyone shifting blame from one institution to another. So if these things were agreed upon in 2013, I don't see why there's now a turnaround where people are not willing to implement what they signed for.
All right. Thank you very much, Elizabeth Wala. Pleasure
welcome.
talking to you, former CEO of the Kenyan Medical Association, as well as a medical doctor. You are watching KTN Prime here.